Why isn't my hair getting thicker with finasteride?
Finasteride is one of the most prescribed drugs for the treatment of male pattern hair loss worldwide. I routinely prescribe finasteride as well as dutasteride for male pattern hair loss. Many patients express their concern of continual hair loss and lack of significant hair growth while taking finasteride. They ask if it's really worth taking or they believe the drug just doesn't work for them. I'll discuss my experience with managing male pattern hair loss with patients who've been on finasteride before even seeing me, as well as my strategy for its role in the management of male pattern hair loss. I'm Dr. Amiya Prasad. I'm a board-certified cosmetic surgeon and fellowship-trained oculofacial, plastic, and reconstructive surgeon. I've been in practice in New York City and Long Island for over 25 years. Throughout my career, I managed hair loss with surgical hair transplantation as well as finasteride since 1997. Optimizing hair transplant outcomes was my core objective for many years, since hair graft yield was frequently diminished by the survival of the transplanted hair. Imagine the pain and frustration for the surgeon, technicians, and most importantly, the patient, if 30 to 90% of transplanted hair just doesn't grow. I experienced a significant revelation in 2011 when I used extracellular matrix by the company ACell and platelet-rich plasma for the improvement of hair graft survival and donor area healing. I observed that 1 year after surgery, even in a patient with advanced hair loss, that thinning hair became thicker. I made it a mission to determine the potential of this observation over the next several years to develop a predictable and highly effective non-surgical treatment for male and female pattern hair loss. Based on the development of customized formulations and treatment plans using specific characteristics such as age of onset, gender, rate of progression, and degree of hair loss, I created the Tricostem Hair Regeneration System. I was able to help patients non-surgically with long-lasting results using 1 to 2 treatment sessions with a duration of effect of 3 to 5 years that exceeded the effective scalp coverage of not just 1 but 2 hair transplant surgeries. At a fraction of the cost of 2 surgical procedures and the convenience of having a treatment in less than 1 hour, patients have come to our offices every week from around the world. To make Tricostem Hair Regeneration System more accessible, I built a freestanding center for Tricostem Hair Regeneration in Northern Virginia, separate from our 2 locations in Manhattan and Long Island. During the early development of Tricostem Hair Regeneration, I questioned what the difference would be for someone who was on finasteride before coming in and having their treatment. Finasteride is a DHT or dihydrotestosterone blocker which works by blocking an enzyme called 5-alpha reductase. This enzyme is responsible for the conversion of testosterone to dihydrotestosterone. In male pattern hair loss, hair sensitive to DHT is subject to hair thinning and eventually disappearing. An important point is that finasteride does not stop hair loss progression, but rather it slows down hair loss progression. So to use an analogy, imagine a train going 100 miles an hour being slowed down to 30 miles an hour. It'll still reach its destination, but much later. I've had the unique opportunity since 2011 to observe hair growth behavior in a wide range of men and women of all ethnicity and ages. This continues to be a unique and unprecedented perspective attributable to the fact that I see patients after Tricostem hair regeneration treatment every 3 to 6 months and annually for 5 years and beyond. Based on these long-term observations, I concluded that there is a range of DHT sensitivity among men that directly affects the effectiveness of finasteride and Tricostem hair regeneration. For example, I categorize men who start losing their hair in their late teens and their early 20s as having high DHT sensitivity. Men whose age of onset of hair loss is much later and slower, I classify as having lower DHT sensitivity. Based on these observations, I have customized treatment plans for different categories of male pattern hair loss. I've generally observed that men who are on finasteride, whether they perceive progression or stability of their hair loss, Tricostem hair regeneration treatment has helped them have improved scalp coverage through the reactivation of hair growth and thickening of individual hairs. I've come to the conclusion that finasteride helps to preserve the longevity of your hair follicle's lifespan, but finasteride does not stimulate growth or maximize your potential scalp coverage. Essentially, there's an opportunity for synergy combining a DHT blocker with Tricostem hair regeneration. With patient data starting in 2011, the Tricostem hair regeneration treatment has shown visible improvement in hair thickness and scalp coverage in over 99% of male and female pattern hair loss patients. Although there is finally in the general community acknowledgement of the benefits of PRP or PRP with ACell in the management of hair loss, the current standard of practice amongst medical retailers is to require patients to have scalp injections every 3 months. As a much more advanced system, Tricostem hair regeneration treatment is typically only 2 treatments, 18 months apart, with sustained benefits for 3 to 5 years and longer. So while a drug like finasteride is important to slow down hair thinning in male pattern hair loss, it appears that finasteride alone does not maximize hair coverage, particularly in men who've experienced hair loss progression while taking finasteride. The unparalleled results from the synergy of finasteride with Tricostem hair regeneration makes this an optimal strategy in my practice. I hope you found this information helpful. Thank you for your question.